All right, we are recording.
Perfect. So I know the announcement came out and many people were excited about moving to stage three. And probably right after that, when you realized the York region wasn't one of the regions moving into stage three, there was mixed feelings there. But I mean, slow and steady is going to win the race here, and I'm sure Mayor Taylor will take us through that. Mayor Taylor, I did see the discussion at York Region Council, and I want to thank you on behalf of the businesses for voicing the concerns of business there. I did hear that, and I was thrilled to hear you do that, and I'm looking forward to the conversation today. Quick shout out to Don Gallagher Murphy from MPP Christine Elliott's office, who's on the line today. And from our town council, in addition to our mayor, we have regional councillor, Deputy Mayor Tom Bay, Councillor Christina Bazance, and Councillor Bob Kloppies. So thank you for joining us as well. From our board, we have our chair, Jim Van Duzen from New Roads Automotive Group, and Pierre Bonham, our treasurer from Shigaris Bonham Chartered Accountants. So thank you as well. I think just before we get started, I will have Abdus do a quick update. I mean, Abdus, obviously Mayor Taylor's going to take us through the mask mandate and how it's rolling out in Newmarket, but do you have other updates that you wanted to share with us today?
Yeah, hi, good morning, everyone. I'll just keep this brief. Obviously, stage three captured a lot of focus yesterday, but the other noteworthy announcement was that CEWS, the Canada Emergency Wage Subsidy, has been extended through December 2020. If you are a business that has been using CEWS to bring to keep your employees or bring your employees back, that will be available to you until December 2020. The eligibility criteria concerns that a lot of you have reached out to me on in the past, they still remain, and it is something that we're working on through our partners at the Canadian Chamber of Commerce and industry organizations across the country. And it's something we're very mindful of as well. But in the interim, I know that there was the certainty is a big thing within the business world, and I think this is definitely something that can help guide us through COVID, and especially on the recovery aspect. The mayor is obviously going to touch on stage three and how and the mask announcement, but it's unfortunate we're not in stage three right now. However, it is something that will happen in consultation with York Region Public Health. When we are in stage three, 99% of businesses will be allowed to go back to work, and that includes gyms, any venues. It will expand the social gathering limit. It will keep the social gathering limit till 10, but indoors will be allowed to expand to 50, and then outdoors will be allowed to expand to 100, and that's just at events. So not the announcement we wanted, but hopefully we'll be there soon. A lot of the concerns that have been asked about in the past on when a business can open, a lot of that is guided by regional public health, just like this announcement. So I will end it there.
Perfect. And so that we have lots of time, I would like to turn it over to Mayor Taylor. Thank you again for joining us this morning. Big news, and I think it's good news, really. So we'd love to hear from you.
Well, thanks very much. It's great to be here. Whenever I read and hear and think about a chamber breakfast networking session, I smell bacon immediately. Unfortunately, it's just in my head today, and we'll have to wait for a few months to be back together in reality and have some bacon. But in the interim, there's lots to talk about for sure. And so I'll try to go through a fair bit of it as quickly as I can, so that leave as much time as possible for questions or comments, etc. To start with, I just again want to touch on the COVID numbers to begin the conversation, because I think that's really what is at the core of what guides ourselves and the region, medical officer of health in the province. So on the good news there is that the numbers in Newmarket are very good, right? We have almost nobody hospitalized, no one in ICU, one or two depending on the day hospitalized. In Newmarket, we only have about a dozen active cases right now, which is phenomenal as well. And we're not even seeing one new case on average a day. Now, York Region still has more numbers than that. They have about 315 active cases. And the total confirmed cases in York Region to date is 3,150 roughly. So you're talking about 10% still active. 350 healthcare workers have been infected through that time period, 84 workplace clusters, et cetera. So other good news is that, we're at 0.84 for those of you who follow that R rating, that R number, that, you want to keep it below 1. 1 means there's 1 new case for every case that is created. It's not creating, a new case of COVID isn't creating 2 or 3 new cases. And if it's creating less than 1, that means it's shrinking, right? Your case number is going down and down because it's not even creating 1 case for every existing case. So, the key is to have a number below 1. And that's, we're below that, but only just, right, at 0.84. So we've got to keep on top of that as well. Those numbers are very, I think, very reassuring. And I think that's why you're seeing a discussion, obviously, at the provincial level about stage 3, because the numbers are very good. And Toronto's are quite good as well. Believe it or not, it's more Hamilton, Niagara, and Peel they're still having some struggling numbers. But the numbers are quite good. Now, having said that, and I think everybody's probably gotten used to where I come from on this. I come from a place of caution, cautious optimism. And so, things look very good. But again, keep in mind that our medical officer of health for York Region, who again, I would say is one of the more respected in the country, he and other medical officers of health believe strongly that there is still the potential for a second wave, September to December, of equal to or greater size than the first. And we have to keep that in the back of our minds. Put it in perspective, because people think, well, everything's good here. We don't have many active cases. So why is everybody so worried? And of course, I see a lot of emails that I get and social media comments saying, come on, let's get going. Like, quit scaring people. There's barely any number. The numbers are perfect. Look, I'm not the only person here who watches U.S. media. We know what's going on in Florida and Texas and California. Look, the good news is Ontario's posting 100, 150 new cases a day. By contrast, Florida is posting 10 to 15,000 new cases a day. So that can do 2 things to your psychological position, right? That can make you feel extremely good and confident of where we stand right here, or it can also remind you how quickly it can go the other way. The only thing difference between Florida and here is the steps and the measures that have been taken, and the support from the community and the business community to follow guidance and advice from the medical establishment. That's the only difference. I mean, people in Florida are no different than us. They don't catch it any different than us, any easier than us. And so that can happen here. It's that simple. Any thinking otherwise is not accurate. So I think we have to look at that. I mean, I'm sure some of you even read in South Africa. It's just starting to, but it is ripping through South Africa. I know a person, a colleague here at work, whose aunt passed away in South Africa and was told not to come to the hospital. There was absolutely no way they would get in the door. That's how quickly systems can get overwhelmed. And South Africa has a pretty mature healthcare system. So it's very challenging from that perspective when you look internationally. We're in great shape, but we've got to keep it there. And so that's my way of segueing into the stage 2 to 3 discussion, which is that you might have seen it in Newmarket today. I stated it, and I think Abdus and I are slightly a different position. I'm not disappointed. I'm sorry, and I'm sure there's going to be some people on this call that don't want to hear me say that, but I am not disappointed that we're moving that we didn't move to stage 3. I'm disappointed, of course, that we don't have 0 cases and it's perfect and everything looks perfect, which would allow us perhaps to move more quickly. Our numbers are very good. If you look at those alone, I guess, yeah, stage 3 seems very realistic. And I suspect we'll move there in the next week or 2. But the regional approach by the provincial government, I support it fully. I think it's a very wise approach. It allows jurisdictions with much lower numbers to move forward. And I wouldn't want to see any business anywhere in the province, never mind York Region, suffer one day longer than they need to. But having said that, it also gives us the opportunity to see how some of those things go in those areas, how it rolls out. And so I think that's an advantage. But I also would say this, I'm even with great numbers, I'm still nervous and concerned. I think moving to stage 3 to support the business community is a necessity, and we're going to have to try to manage it, and that'll lead later to the discussion on masks. But I will say this, I'm nervous about the idea of gatherings of 50 people indoor or 100 people outdoors. If it's for a business, if it's for a restaurant to reopen under stage 3, fine, that's the number of people that would be allowed with the social distancing. But I'm not sure we should start holding anniversary parties in banquet halls with 50 people. That part makes me a little concerned. And I hope people still show a lot of prudence and self-regulation in those areas. And this is something that I hope is only done if necessary, and it's rarely necessary to gather like that. So I really hope we continue to be a community that enters this cautiously, because as I've said, it's not just about health, it's not just about the potential for future deaths, which obviously is very real. But if we go the way of even a part way, the way of Florida or Texas or California, we'll have to shut back down again. And I know there's many people on this call that can't even begin to imagine how hard that would be on their businesses. This is taking this slow, taking it cautiously, moving forward to step 3 carefully and cautiously is mostly, frankly, about the economy and making sure that we don't overly negatively impact the economy as we move forward. And so awaiting a week or 2 or 3 or even 4, I dare say, I don't think it will be that, but if that meant that we could move confidently into the fall and feel that we're very unlikely to have to go backwards, those days are worth not having to close back down for a month or 2 or 3 in the fall. That's my perspective on it. I think that's a perspective that's shared somewhat widely. As was stated by Tracy, let's if we take us a little bit cautiously, one step at a time, we can move more safely and more confidently into a long-term permanent reopening, which is, I think, everyone's goal. So as we move into stage 3, which is certainly going to happen, we need to be extra vigilant. Every stage of reopening requires us to heighten our vigilance when it comes to the directions that are being provided from the medical establishment, medical officers of health. And so, 6 feet, 6 feet, 6 feet. I always say it 3 times over because they always say people hear things the 3rd time. That remains paramount. And I'm just gonna be frank. I'm seeing people more and more not staying strong on 6 feet. I see it constantly. Are we still doing really good as a community? Absolutely, absolutely. I think the majority of people are really taking this seriously because, as I've said in some pieces I've written recently, if you don't stay 6 feet apart, you don't practice constant hand hygiene, and you don't wear a mask in indoor settings, you are putting people's businesses at risk. People who've spent their lives building their business, you're putting them at risk out of your inability or unwillingness to stay strong and stay vigilant and stay focused on what we need. So that's my way. I just want to keep emphasizing this. So another stage of reopening means we all need to become even more cautious. If that's possible, for some that may not be possible, thank you for that. But we really need to do that. And so that leads to the discussion and the decision at the region around mask wearing. And I suspect there'll be a lot of questions on this. There might even be a couple I can't answer, but Samantha Eek, my assistant, is on this call as well, and she'll jot down anything that we can't get answered and get back to people out of the chamber and in general. So the mask wearing decision was actually somewhat of a tough decision at first, but it was did a lot of research. I did a lot of my own research, waited for the medical officer of health's report and staff's report, looking at what other jurisdictions have done, et cetera. I can tell you, and I received probably more public input on this than any issue since I've been in office. There was a lot of, there was significant support for this direction. I think large support, but there was still significant concern. And I received, the other thing I've never received before is as much links to scientific research, both pro and con. And if I were to take all research at face value, apparently you could prove either direction wrong very quickly if you wanted to. So there's a lot out there. There is information on York Region's website on some of the scientific research related to masks. I'll be the first to state, and so would our medical officer of health, that the research on mask wearing is not conclusive. They're starting to emerge and show strong indications through some of the research that mask wearing is making a difference. Certainly, if you look at different jurisdictions globally, you can see that at least anecdotally and certainly from just pure numbers and correlations, that it's been having a significant effect in some countries in a very positive manner. There's a number of studies that'll point to it. We'll provide you with a link, or you can go to york.ca and find some of that research that supports it there. But I will say this, two things. And this is, I'm just trying to maybe simplify it as much as I can. I know there's some people who strongly believe that mask wearing can be harmful to your health. And I know that there's some people that doubt that mask wearing does much to stop the spread of COVID-19. Whether mandatory or not, take that aside for a second. The bottom line is that virtually every medical officer of health who have spent their lifetime studying and practicing public health recommend mask wearing. They all recommend it. I don't believe that these people who are steeped in knowledge and expertise globally would recommend something that was A, harmful to you, or B, something that made no difference or was unlikely to aid or support stopping the spread of COVID-19. That is a very simple way of looking at it, but I believe it does speak volumes. So our medical officer of health did provide a recommendation to us, and that recommendation came in the form of the motion that we passed. I want to be clear here. I supported this almost entirely related to the potential for a second wave in September to December. As we reopen into stage 3, the risk goes up. There's no two ways about it. And as we go into September, with schools going back in all likelihood in some form, in some capacity, as more people return to workplaces and settings, or you have gatherings, larger gatherings of 50 people indoors, the risk goes up and the numbers go up. And so the chance of that second wave is real. And mask wearing is another tool. It is not a replacement tool. It's another tool to support 6 feet social distancing and hand hygiene. The three of those together, if we are very cautious and committed to that, will, I think, allow the movement to a third stage to go very well. But it really does require us to do that. So I think that, we're getting ready for that. The mask wearing will support that. I want to be clear what the motion is. And I don't know if, Sam, if you can put that up, or if put up a link to it or not. But if not, we'll get that to the chamber later and to be distributed. But in essence, the motion actually does not fully understand. It represents mandatory mask wearing, but all it requires, and this is what Tracy was alluding to, I really wanted to make sure that we weren't putting the burden for this implementation of mandatory masks on the business community. And so the motion actually only requires the business or the public space to have a policy, and we provide a template policy, and signage. It does not require you to refuse people entry or business. And it also actually, if you look at the templated sample policy, it actually explains in the policy that your policy for your employees should be to not deny entry or to ask for proof from somebody with a medical exception. So again, we're not looking for you to police this. We're not looking for you to enter into debates or confrontation. We're asking you to have a policy and signage, and to follow that policy yourselves with your employees. Our goal here is not perfection. And I know it's going to be tricky, and I'll get some questions about that, and I accept that. But I'm a big believer in the statement that perfection is the enemy of progress. Maybe I like that because I'm so imperfect. I don't know, but the key here is to try to get mask wearing numbers up. In our study from the Medical Officer of Health, they did audits in 3 malls, Vaughan Mills, Markdale, and Upper Canada Mall. And the mask wearing in the other 2 were in the high 60s, 70s% a week before this was passed. At Upper Canada Mall, it was at 52%. And so one thing that science does believe is that for mask wearing to become very meaningful in stopping the spread of COVID-19, you need to get up to about 80%. And so we believe that this policy will, I think we've seen already signs since the policy was passed. And once it comes into effect, and as people and we're going to be investing a lot of money into education, that the mask wearing numbers will go up and up and up. And again, I could go on this topic, but I think I'll wait for questions on it more. But I will say this, that if you have a medical exception, you do not need to wear a mask, and you should not be asked about proof or et cetera. And will somebody take advantage of that? Possibly, perhaps. But I will say this, if there is one business, never mind 10, it's probably more like 10 or 20 in Newmarket alone, that can be either strengthened or saved for us to wear masks when we go into Home Depot or to Metro grocery shopping. Is that a limitation on our civil liberties? It is a small one. Is that much to ask, again, to support the business community, to respect people who are elderly or immune compromised? I think in this circumstance, it's not. And I think, I really hope that even those of you who don't agree with the direction, and I suspect there's some on the call, I certainly know I've heard from a number in the community, and that's fine. And I've had some good exchanges with people about it. But I just hope that you'll still get on board. I hope you'll still say, hey, I might not fully agree, but this is what my community, my neighbors, the elected officials, and more importantly, the medical experts have decided. So I'm going to, even if you do it grudgingly, I'm going to go along and support this, because I think the highest level of support we can get to, the most success we'll have. And again, we want to just make sure we can avoid any future reversals in the opening process. So I think I'll leave the mask conversation there, because I'm sure there'll be a lot of questions around it. I just want to also mention to people that there's obviously still a lot of local initiatives going on. The town partnered with the Chamber of Commerce. So those continue. We still have the tax deferral, property tax deferral in place. Some of you may know we've just implemented a full waiver of fees for signs for businesses to, if you apply for sign permits, et cetera. The patio program is going very well. I'm seeing several examples around town, and obviously a lot in the downtown. Shop Local is still going strong. The mentorship program, all of this under the Business Assistance Concierge program, which is a partnership between the Chamber and the town. And the latest part to that is starting Thursday, July the 16th, there'll be industry tailored roundtable series led by York University faculty. So Thursday the 16th is manufacturing. The 20th, July the 20th, retail and hospitality. July 20th, information, communication, and technology, ICT. And then also on the 20th, business and entrepreneurs. So there's those that are ongoing as well. And if you need to find out more information about the sign waiver, the fee waiver, please feel free to contact anybody on council or myself in the office, or the town's economic development department or the chamber. I suspect has that information out there. They're ready as well. So lastly, I just want to finish off talking about, I try to mention or emphasize each time, is that the town is also, we're ensuring, and I'm having discussions with our senior leadership team here all the time to ensure that we're not focused only on COVID. Just like yourselves, we have to understand and work with implications of COVID. But we also have to focus on our business and where we're going to be at in 3, 6 months, and 12 months, and keep the wheels turning. And so we're doing a lot of work to continue to advance. We'll be meeting as council in July to try to keep moving some planning initiatives forward and some housing options forward. We are continuing to work on the plans, on the designs, which was contracted some time ago for the Mulock Farm. We will not move forward on any expenditures on that until we know more about our budgetary situation, but those decisions will come later this year. We are into a very challenging budget year. As some of you probably know, by provincial law, I think a very wise provincial law, municipalities are not allowed to run deficits. However, virtually every municipality in the province is going to run a deficit this year. We're projecting by the end of, I think, August, maybe it's the end of September, but about an $8 million deficit for Newmarket. We've never had one before. But I know that the province is speaking with the federal government, and they're trying to work out some understanding, some terms for municipal financial support, because our financial tools are not that robust compared to other levels of government, particularly the federal government. in our ability to manage those kinds of setbacks. So we will hopefully be, and I believe we will be receiving some offset or some support to manage through that. The region is much more significantly financially challenged as a result of COVID. They are amassing tens of millions per week. Any upper tier or single tier like Toronto jurisdiction that has public health, community and health services in transit, like York Region does, is amassing significant financial deficits at this time. But we want to try to manage through that. We want to lessen or eliminate the impact on the taxpayers, particularly given what's going on. But it's going to be a struggle, as it will be for other governments as well. But we are very focused on that. We're very focused on making sure we know our numbers and that we're managing them the best we can. And we're doing quite a bit at the town to mitigate as well, as we're not just looking for support from the province and the federal government, but we're mitigating some of those costs. But we're also moving the town forward and trying to ensure that we continue to build one of the best communities in Canada to live, because that's where business thrives. So I think I will leave it there and to take any questions at all.
Thank you, Mayor Taylor. I do see some questions coming up on the side. One of them that came up, and you probably have an answer to this one, is they are still able to refuse entry if that's the policy that they have posted. So while they don't have to police it and they don't have to ask people not to enter their premises, can they still do that if that's part of their policy?
So it's a fascinating question. So you might know more, Abdus might know more than me, but I actually yesterday started reaching out for a legal opinion on this because it's come up already. I'm not positive. It really, refusal of entry to a private business often comes down to the details of the reason for the entry and whether that's seen to be discriminatory in a broad-based manner, and whether this would qualify or not, I'm not certain. So I'm looking into that, but somebody may already have, I'm sure somebody in another town or city already has the answer, or maybe somebody you do or Abdus does, but I haven't got it yet. I just sent an email yesterday asking for clarification on behalf of the business.
No, and that's fair. We're doing the same, and we are talking with a number of jurisdictions. Nobody seems to have a clear answer yet. And I know Nature's Emporium, Mary's going to talk a little bit about that on our July 23rd call, because there were people looking to, take litigation on human rights issues. So, and yet they had staff impacted by COVID. So that was why they went. They have a posted policy.
Yeah, sure.
It is one of those gray areas for businesses. So I know it was raised on the side as well. So we'll try to continue to get that answer.
And it's particularly tricky because there are exceptions.
Yes.
And it's not clear as to, our template policy and our suggestion to people is to businesses to not challenge those exemptions. But a business, again, could they choose to do that? And if they did, what would suffice as adequate proof to that business if they chose to? That also gets very interesting, because first, can you deny? But then secondly, can you deny even an exception? So hopefully we'll have some legal clarity on that shortly.
Yeah, and I think if they're denying it based on a medical reason, it would be like with any of the AODA, you can't really ask for proof. However, I think it's when people say they just don't want to wear them. That's kind of where it comes in more than anything, because I think the businesses are used to not asking.
So if I get something clarified on that today or tomorrow, I'll send it to you as well. And
okay, perfect. Thank you. We also have a lot of questions coming up around exercise. So whether that be dance studios or fitness facilities, while they're doing physical activity, do they have to wear masks indoors?
I'm not positive on that one either. I said to somebody, I said, this is going to be a call where I'm going to get some ones I'm not sure, because it's all so new. Partially, let me explain to people too. The reason I don't know all this is because we couldn't, this was a 7-hour meeting. If we also tried to identify all of what the rules and exceptions will be, we would have been there for 2 or 3 days. So we essentially delegated that to the staff and the public health staff. And so they've been working through that information and the types of questions that come up. We'll try to find that as the call goes on. Sam, I don't know if you've got any ability to try to look that up on the website. We do have and again, Sam, are you able to post any of this or no? Can you just come on for a second?
Tyler, you can open up the sharing
Yeah.
screen.
As I'm gathering information, I will post it into the chat for everyone.
Okay, because there is a very good key messages piece about a lot of Q&As and stuff like that. So we'll get that up as well.
Yes, sounds good.
Yeah, and I think the other piece is we know that they're still kind of ironing out all of these policies and seeing what best practices are. So hopefully by the 23rd, when we have that other call, we'll be able to answer a lot of those very specific questions.
Yeah, and one thing I can clarify for you, because it was one I knew would come up very quickly, and I was glad to get the answer we got. But if you're behind a plexiglass divider, you are not required to wear a mask. So if you've already gone to the expense of putting that in and the trouble of putting that into your business, that does suffice.
Tracy, there's been a few questions too with respect to inside a business. So even I guess you could use our chamber offices. Are employees required to wear masks? And then Jennifer McLaughlin from Cachet, when we go into phase 3 inside a restaurant, what is the policy? Does phase 3 include being able to eat indoors at a limited capacity, and will people have to wear masks?
Right. So my belief again is, and we'll try to clarify this, is that eating indoors in a restaurant, you would not be required to wear a mask, and you are not required to wear one on a patio if you're eating, because if you're eating. But we can clarify all of that as well. However, mask wearing is for the servers as of Friday would be required under the policy because they're in the public space area. If you're in you need to have a policy. That's one of the requirements. Your policy should explain it, and it could be a one-page policy. Our template's only one page. You can use it and modify it, but you could describe in your policy what you deem to be the public space, the public aspect, or the open to the public area of your business. Anything within that area is anyone is required to wear a mask, with the exceptions. In the non-open to public areas, so I sit in, often I come in and I sit in an office. I have my own separate access to the side door, and I see nobody. And this is not a public space. I do not and cannot hold meetings here currently. Our offices are closed. I don't need to wear a mask. So I think you've got to delineate that for yourself. But I think if you do it in a reasonable way and you say this area really we don't have people into, my understanding is you do not need to wear a mask. However, you should still be striving to be 6 feet apart. And if you are 6 feet apart, that's a relatively a good position to be in.
Mayor Taylor, that's my understanding as well. And Enterprise Toronto has done a really good job of kind of outlining all of those gray areas. Now, I don't know which ones our region will adopt. That's still open, but yes, that was my understanding. In your place of business with your employees, that's different, and that yes, you can remove the mask. It was my understanding for physical activity indoors as well, as long as there was spacing, but that again, that's a Toronto based. I'm not sure
right.
Our region is going to adopt yet.
I suspect it will be very similar. If for no other reason, there is no perfect formula, number one, and number two, consistency is helpful because you're going to see education campaigns begin, and the more consistent the educational themes that cross over steels are, the better. So I suspect you'll see something coming up very similar. And I'll be honest with you, when we were at Regional Council, there was a vote that was about to take place without really any notice of any sort. And I asked for that to be deferred to a special meeting of council. And one of the reasons was because I knew Toronto and Peel were on this. And I, once again, will say I'll be happy to wait a week or two, even in this case, after others, and they'll work out a lot of those difficulties and details, and it'll make the transition into this a little smoother here. And again, I'm really glad we moved towards mandatory masks, but the urgency is at this moment wasn't that great. It's really about being prepared and in the right place for stage 3 and the fall with the potential second wave. And so having a week or so to understand this better and to allow Toronto to start to iron out the wrinkles, I think is working out well for us.
Yeah, and I think the 23rd, for people that are on the call, we will have somebody from Toronto here as well on the call. We'll have York Region on the call, York Region Health. So the conversation will definitely be there. And if there's gray areas, we can have those conversations. So this is really new, and I appreciate Mayor Taylor that you don't know, any more than the rest of us on the details.
I'm willing to try to answer as much as possible along with your assistance, because I know people are curious and anxious to try to understand this. But as you said, I mean, when our public health officials come out on the 23rd, they'll know the answers to, well, I won't say every question, because sometimes a question can surprise you, but they'll have a very clear understanding a lot of those more operational details.
I do have another question that a member had brought up, and you might not have the answer to this one, but someone had said they've been wearing a face shield instead of a mask, and went into Longo's recently, and within this past weekend, since the announcement that it was going to take effect Friday, and they were refused entry. So she was a little confused. Any light you can shed on that? I
can on that one. I have checked with I wasn't sure about where that stood either, because it is a type of face covering. However, our medical officer of health doesn't feel that that's sufficient. And so he would concur with Longo's. And this order will make the distinction that the face shield, it does not suffice. Some people will want to wear that as well, but it cannot be replaced. My guess is, and you could ask the experts at your next meeting, our public health experts. My guess is, though, if you had a medical reason to not wear a mask, but still wanted to wear a shield because you felt comfortable with that, that might be allowable and recommended. But that I'm not certain of, but that would make logical sense to me.
I would agree. Jennifer, are there other ones on?
One of the other ones was, given that York Region was a week behind going to phase 2, do you anticipate that will be entering into phase 3 next Friday, a week behind? Do you see that being the progression?
I do. It could be 2 weeks. I'll say this, at the risk of becoming unpopular with some of the participants today, I would prefer to see more than a week. I would prefer to see this get a little bit more rolled out and understand how it's working. And I think just getting the mask wearing, giving it a little more time to get normalized and increase our numbers higher. That would be my preference. And again, I don't do this to be, a fearmonger or to be overly cautious. I really, the thing that motivates me is not wanting to have to see future closures or reversals of stages. And the thing that motivates me there is the business community. I can tell you, but I've had numerous one-on-one conversations with people in the business community, and some very upset and distraught people. And so I know that every day seems precious, but I think my instincts tell me it will be even much more impactful and stressful to have to go backwards. And so I think, so I think it is coming very soon, but I also think that deep down we should probably be comfortable with taking it a little bit slowly.
There's a couple of more questions on the side. One of them is, would we have access to a platform where Newmarket businesses can share best practices and challenges? I'll just quickly respond to that one. The mayor did announce roundtables that are sector specific. That would be a great place to share best practices and hear what other people in your sector are doing. And that is why those tables were put in place. They're facilitated by York University, so they'll be sharing with us the best practices that they hear as well. But it really is a forum for you to get together and talk about that. The chamber will share any information we have. This one actually, Mayor Taylor, I'll have you speak to. Can the town take the initiative to educate the citizens of our town on the benefits of mask wearing, either by Zoom, town hall, or otherwise?
Yeah, and I think right above that it says this should be an education campaign. So let me also assure everybody, and I'll see if I can find the motion here. The motion that we passed actually says that the instruction that we passed shall further specify that best efforts shall be made by operators of enclosed public spaces in good faith to only allow entry to persons wearing a non-medical face covering, and that education rather than enforcement shall be the principal objective of the instruction. So this is viewed by York Region Council as primarily an education campaign. certainly an education campaign first. And just so you might as well manage expectations for those people who, see somebody somewhere enter, Home Depot without a mask on. We're not going to run down and ticket them. We may run down and chat with them, or somebody in the store may hand them a slip of paper and say, "Would you please consider this?" But this is an education campaign first and foremost, and I believe it's going to be a successful one. So the town will do some work around education, but it will be primarily done by the Region of York. And to put it in perspective, the Region of York has budgeted approximately $300,000 for that education campaign. So we understand how important that component is. And I think when you couple that with the campaigns that are going to be coming out of Peel and Toronto, it's going to be, I think you're going to hear a lot about effective mask wearing and the merits of mask wearing in order to get those numbers up. Again, we need to get above 80%, and really we should get above 90. And then there's exceptions as well that you have within that. The other thing I'd say to people, this is important to me too. I know there's a number of people on the call who are really pleased with the mask wearing and are glad that we're moving in mandatory mask wearing. But I will say this is, I really think that it's important that we try to be as patient and understanding with people. Just remember that that the person that you're viewing and you're thinking, "Oh my goodness, I can't believe they're not wearing a mask. They may be a severe asthmatic." And we don't know that. And I really think that our goal here is through encouragement, signage, and education is to get the percentage of mask wearing up into the 80 and then into the 90% range. And I don't think, we really don't want people confronting other people or being, unneighborly one way or the other. And there's examples in both directions. We know there's difference of opinion, but let's just all really work hard, stay positive, and the region will deal with the sort of the education and encouragement, and we'll have people out having conversations. And I know and stores can find ways, very very polite educational ways to encourage this as well. Some of you may choose a stronger approach, and that's up to you. But I would say in general, let's just remember that we're all in this together, and we're not always going to agree 100%, but I think the more people see mask wearing and the more they see the merits in it, and the more we realize that we're doing this as a team, I think people will come together and get on board in terms of wanting to join what is going to be a successful direction.
I have one more question, sorry, just to clarify, because you had touched on earlier, if they're behind plexiglass, they don't need to be. So for example, in a retail store, if the person working is behind plexiglass, I mean, I've been in Home Depot and some staff are wearing and others aren't because they've got plexiglass buffered by a table and you're that far back. So that just, because you're going to, as you said, have people saying, I was just in this store and they weren't wearing them. So if they're behind plexiglass, they don't need to be wearing a mask.
That's correct. And I think, I'll just, it's still, there is some very early scientific thought that there may be a certain amount of aerosolization related to this. But generally speaking, the scientific community still believes that this is spread by what is they term droplets. And so a plexiglass shield will stop that. Again, you're talking about a shield. Now, those plexiglass masks, they're not that large, and it doesn't necessarily, stop things. And that's a bit different. But if you're sort of in your own space and there's distance between and plexiglass, it's the feeling of the medical Office of Health that's sufficient.
And Jennifer, I think you're bringing up a good point. It's perspective, and we'll be tackling that in the Why Our Biz series, but the customer models have changed. They've turned on their heels, where health and safety is number one for a lot of customers right now. Mm-hmm. And so they will judge you based on how safe they felt in the retail store or the restaurant they were in ahead of you. Sure. And we need to have those conversations as well, because businesses need to understand that could impact their bottom line.
And also just to be clear too, I want to be clear that some businesses, for the very reasons you just stated, Tracy, may say, we want our employees to wear face coverings even with plexiglass, because we want to send the strongest message possible. And that's our position at the region isn't saying that a business owner can't take that position. Right? So that's still the discretion within that business setting.
Now, Jennifer McLaughlin I don't know, Jennifer, did you want to ask the question or we can read the question?
You can just read it. Thank you.
So she's saying their servers on the patio don't wear masks as they work 8-hour shifts in the heat. The policy written and the training they received is that staff don't get within 2 meters from guests outdoors. So do the new requirements change that now?
Yes, the new requirements will require masks in those settings. They certainly require, let me put this, they certainly require them when they're inside going, you know, but I'm almost positive that is required. I'll double check, but I'm fairly certain that it does.
Okay, thank you.
Yeah, I think that's my understanding as well. We can get clarity on that. I see that Dawn Gallagher Murphy, you've been adding a lot on the side chat. Do you have anything you want to add for us from MPP Elliott's office?
Thank you, and great to be here. And thank you, Mayor Taylor. That was a great overview on the mask. A couple of things I just wanted to highlight that were brought up yesterday, which I think are important about the social circles. So I wanted to reiterate that point that social circles are the small groups, and it's still at a maximum of 10. So potentially that can increase, but right now at this point, it's still 10. So those are the people that you can hug and touch, etc. So beyond that, you're physically distancing. So I think that's important. I've been just trying to look at some of the questions coming in and seeing if I have more answers for you. One of the things I can say, because I was getting this a lot yesterday, and I think Mayor Taylor has touched on it, is that when will we actually see York Region go to stage 3? I can say that from what I'm hearing and seeing based on the numbers, potentially the long weekend, first weekend of August, you may be seeing York Region into stage 3. Good news, bad news, but that's what it's looking like based on the numbers, unless something changes over the next couple of weeks. Other than that, I think it's also important to reiterate what the social gathering is in the groups of 50 people indoors versus 100 people outdoors, because at all times you have to maintain the physical distance of 2 meters, and that includes in a restaurant or in a gym. So if a gym area has weights, for example, you have to have everybody physically distanced 2 meters. If you've got a big enough space, then that's up to 50 people maximum. Another thing I wanted to reiterate is, what does a gathering refer to? That is a planned or spontaneous event, indoors or outdoors, which could be a community event or gathering, a wedding, a funeral, a concert, a live show, a festival, conference, parade, sporting event, fundraiser, a fair, a festival, or an open house. These settings are all subject to gathering limits until we get to the recovery phase. So I think that's important to take into consideration. And I will just reiterate, I have heard the comments of people seem to be getting a little bit lackadaisical, or when they're wearing a mask, they still feel that they can get closer. The only people you can get closer with are your people in your social circle. Other than that, even wearing a mask, you're still doing your 2 meter physical distancing. Other than that, there's lots of information going on. I'm happy to answer anybody's questions as best I can. I will put my email address in the chat. One last thing, it was announced last Friday, the government is very much pushing the Ontario Made program. And I think that's important. It's by Canadian manufacturers and exporters. So there is a new label that we can put on Ontario Made products. I've been seeing a lot of great feedback on this through social media. So I wanted to put that out there because that's one thing our Ontario government is going to be pushing is made in Ontario by Ontario. You'll see that MPP Elliott was here just a couple of weeks ago, big push on shopping local, supporting local patios as well. And that message is going to be continuing this week. She'll be in Aurora doing a similar type of thing of shop local, and as well as local tourism. We want people to start going to our local centers and feeling confident about it. So I've seen messages about how do you get people feeling confident. Mass is one thing, and still maintaining that physical distance as well. So anyways, I could go on, but there you go. Thank you.
Thanks, Dawn. I appreciate that. I think we are coming close to time, so I will ask the mayor if he has any closing statements for us or anything else you'd like to add.
Yeah, just really to say that, again, even though I tend to talk about how we need to do better all the time, I do want to emphasize that I really believe our community is doing an amazing job, and the business community is doing an amazing job of managing in very difficult times and by following the guidelines of our medical experts. And so I really am feeling, cautiously but optimistic. I think that when we layer on the mandatory mask wearing and Dawn is so right that this is not a replacement for the 6-foot social distancing and hand hygiene, when we layer those things on together and we all stay committed and feel the collective responsibility, I think we're going to be able to move into the stage 3 and manage it successfully. And I think, the challenge will be keeping the second wave down and low. And I think we're going to be able to do it. But I think we're going to be able to do it because people have demonstrated, there's exceptions of course, but they've demonstrated a really strong commitment to this and just feel incredibly proud to live in a town and a region that's doing this well. When I will say this, I don't know if anybody caught it, but I watched, there was a piece on a few days ago on CNN comparing Canada to the United States. And I felt terrible for the United States, but I have to say I felt pretty darn proud of the people of this country and of York Region and Newmarket, because they're taking this as a collective. We're concerned about the well-being of everybody around us, and we're being respectful to everybody and everybody's ideas and opinions, and we're working through it. So I'm feeling very optimistic. I think that we're going to continue to see us move forward, and I think most importantly at this moment for all those challenged businesses, we're going to see revenue slowly increase and increase and increase, and getting everybody back and through this. And again, we're going to say this before because I think it's always great to put yourself into the future, looking backwards. I think we're going to be looking back on this time as not just an amazing time we all lived through, but one where we pulled together, we did the right thing, and we succeeded. And I'm confident we're going to be looking back one day feeling that way very soon.
Thank you, Mayor Taylor. And I am too encouraged. I've seen more people wearing the masks and the physical distancing. I was out on the trails this weekend and felt like it was much better than a few weeks ago when I was out there. So I agree. I've seen the same thing. In some private chats on the side, people have been asking me about templates in other jurisdictions just because they want to get started on their own. We will share some links when Tyler sends a follow-up to this. I'll point some other links that might help in the meantime. And as soon as we get the ones from the region, of course, we will share those out as well.
Yeah, and there is a sample policy template on the region's website. It's very straightforward.
Oh, okay, it is there. Perfect.
Yep, absolutely. Okay. So yeah, I think Sam just posted there's the sample policy.
Oh, perfect. Thanks, Samantha. The other piece, just quickly, and just to your point, Mayor Taylor, I don't think that Abdus was expressing necessarily his disappointment because the chamber is with you on a slow and steady and safe opening, because the last thing we want for any of these businesses to have to close again. So we are very supportive of that. I think he does hear from businesses constantly on a daily basis.
Yeah, fair enough.
He forgets all he's hearing is disappointment in general, but that is not the stance. The Chamber is definitely in support of a slow and steady opening and a safe opening for all of us. So thank you again for your time today. And for anyone who wants to join us on the 23rd or some of those roundtables, please do. We'll continue to talk about how to do this and do this in the best way for all of us. Great. Have a great day, everyone.
Thanks, everybody.
Thanks.
Have a great day.
Have a good day.